Hello, namaste everyone. Am I audible?
Yes, yes.
Yes, yes.
Okay, kindly on your videos so that we can see each other to know each other. So, myself, Dr. Meenakshi. Today, obviously, we all know we joined this webinar to know the further course details, like what is this course, why we have to join, and what all benefits we will get by joining this course. So, to know myself, I am Dr. Meenakshi. I am from Karnataka. I completed my BAMS and post graduation, and presently working as a Associate Professor in Department of Balaroga in reputed Ayurvedic college. With that, even I am a Ayurvedic consultant. So, I think I can better explain you about these samskaras and postnatal prenatal courses because these all topics we will study for nearly 5.5 years in UG course and further in PG course 3 years. So before explaining the course details and what it is, firstly we will know each other so that it will be easy conversation with each other, right? So you all can introduce yourself from where you are and how you joined this course. One by one
Hi,
can.
hi, I'm Gautami. I'm from Hyderabad. One of my friend has shared the link. So through that, I've joined this webinar actually.
Okay, ma'am. Like on which interest basis you have joined this course, ma'am?
Actually, I wanted to know about the Garbhsanskar, so I
Okay,
just joined it.
okay. It's good, ma'am.
Thank
Thank you.
you.
Others?
My my name is Shamili. I'm in Hyderabad. I'm finished my 200 yoga training course in Bodhi. So I searching all. I want to do all yoga courses also.
Okay.
So that's why I'm choose pregnancy pregnancy yoga.
Sure, ma'am. Thank you.
Yeah, hi, my name is Yogita. I'm from Thane and I'm completed my face yoga from this institute. And just from curiosity, I want to join this course.
Okay,
Yeah,
okay.
thank you very much.
Hello, I'm Pratima. I'm from Nepal. Just finished recently. I finished my master's in yoga, so maybe it will help me grow. So I just
For
did.
further detail.
Yeah, thank
Thank
you.
you. So I think everyone has finished their introduction. So as I explained, this will be a course details and I am Dr. Meenakshi. So I think you all know this chart familiar, right? By saying these details only, you have joined this course, I think, right? So it is divided into 50 hours course and 85 hours course. And in 50 hours course, these all points will be knowing. That is syllabus details. That is, you will be knowing about the Garbhasanskara. You will understand the pregnancy and childbirth because it is very needed. Why it's very needed, I'll say further. And trimester voice theory. Theory means like it may be anatomical, physiological changes, what all a woman will go through in both in pregnancy and during a childbirth, even after childbirth, that is postnatal. In all phases, what all anatomical and physiological changes the woman will go through. So what are topics we have to understand. It may be for ourselves or it may be for others. And trimester wise yoga asana practices has like after knowing the anatomical and physiological changes, obviously which all asanas because even we know some part of exercises or asanas. but we don't know that in pregnancy which asana we can do and which asana we can't do, right? So in this session, like in these topics, we will be knowing which asanas we have to follow in pregnancy or during like nearer to labor, because some asanas we have nearer to labor, if we do, the childbirth will be very easier. It may be normal delivery, obviously normal delivery, but in some complication conditions, obviously we have to go for C-section. So asanas and particular exercises which you have to know, you will be knowing, and anatomical and physiological of childbirth. In pregnancy, we will do some parts, but in childbirth, some asanas, like as I said, during nearer to labor, some asanas we have to do so that the childbirth will be very easy. So that we will come to know, and even the what all anatomical and physiological changes the woman will go through during delivery and after 1 month of delivery, so that it will be easy for us to follow and even easy for us to help others. And postures to support a healthy pregnancy. Obviously, in some cases you will know, right? Some doctors, especially doctors, will advise sleep left side only, so that your blood circulation will be good and baby can breathe easily. They will advise you, right? So which all postures are good during pregnancy, so that it will support the healthy pregnancy, we will come to know. And mantra chanting. You all may be thinking, why in pregnancy or delivery we want mantras, right? Has like especially in Hindus, they will chant the mantras or shlokas during puja, and even after morning. We will get up with the mantra only, especially Hindus, right? Karagrahivasate Lakshmi. Even by getting up on a bed, we will say and we will get up, right? So why we have to do? Obviously, we have some positive vibes of that mantras on our mind and our activities, so we will do. In same way, some mantra chanting in a pregnancy will help the woman to be stable, and even it will help the baby, fetus, to grow in a good way, healthy way. So we will get to know which all mantras we have to chant and when we have to chant. That all we will get to know. And mudras and bandhas. Obviously, like in YouTubes and shorts, you will see some mudras or some acupunctures or some chanting some like bandhas, some part of bandhas, mudras and bandhas, what these and why we have to do in particular syllabus topics, we will get to know. But briefly, if you want to know, mudras and bandhas are some sort of exercises, some part of exercises only, which will stimulate our nerves and stimulate our brain activities. And pranayama and its breathing techniques. Obviously, pranayama, we all know it, right? So, nothing but respiration in different sort of respirations we'll get to know with meditation. Meditation means, obviously, meditation means all will think that we should sit in one place and we have to close our eyes and we have to sit simply without doing anything. That is meditation. Obviously, that is not a meditation. Meditation is not only a physical activity, with your mind activity. What all you have to do changes in mind and how you have to do particularly meditation, we'll get to know in a sessions. Obviously, after following these all, diet and nutrition, obviously we should follow in pregnancy, right? Because overall growth and development of a fetus depends on ahara, what the mother take. Ahara is nothing but food. So which sort of food we have to take for which growth or which development of a baby, that too trimester wise, month wise, which foods the mother have to take, which foods she have to avoid, and which food if the mother takes, it will be nutrition to herself and baby, will come to know. And obviously last is, as this is a training course, teaching methodology. After completing these courses, how you have to teach, how you can learn to teach others, because as our Shubh Yoga founders have the further registration process also. After completing of this 85 hours of course, even one of you can become a teacher trainer here, right? So last point in 50 hours is teaching methodology. How you can teach to others, how you can conduct these classes to others. They will teach you, or I'll teach you. This is about the only 50 hours course. Next, coming to 85 hours, with this all 50 hours course topics extra, like we all know nowadays girls are suffering many with PCOD and PCOS. I think you all know what is this PCOD and PCOS, right? Polycystic ovarian syndrome or polycystic ovarian disorder. Even like if you go in metro cities, in 10, most of the women, 5 to 6 girls are suffering with this PCOS and PCOD. Because of this, they will get irregular cycles, there will be menstruation cycle disturbance. With that, they are getting the fertility rate decreased, like they are not able to become pregnant. Even if they conceive also, it's becoming a miscarriage in some part, or fetus will be having some defect. We have many, like due to our technical development, we have many wrong things, like misunderstandings also, like if they have healthier ahara, then it's enough. They will not get PCOD or PCOS. Some women have in their mind. But it depends not only on ahara, even our activity, what we are doing, or the routine life, what we are leading, it all depends on it. So with these 50 hours courses, you will get the extra points to understand the menstrual cycle, hormonal imbalance. Hormonal imbalance means not only in menstruation, even after 40 years, we all have the menopausal stage, pre-menopausal stage, right? In that condition also, the woman will suffer with many hormonal imbalances, or overall hormonal imbalance. Even in menarche is nothing but when the first period starts, from there till menopause, till 40 years, in which all stages the woman will goes to hormonal imbalance, and how we should control it with not only with the medicines, even with home remedies, with ahara, we can maintain these hormonal imbalances. So how we can do it, we will get to know. And fertility. Obviously, this PCOD, PCOS and fertility is interlinked with each other. So we will get to know about this. And sun salute, nothing but Surya Namaskara, yoga therapy for prenatal or postnatal stages, breathing techniques, mudra therapies, month voice, Ayurveda topic about the pregnancy and challenges in pregnancy the woman faces. These all topics will be the extra part in 85 hours course. With this, in 85 hours after certifying, obviously in both courses you will get a certified that this person has completed the classes with us. With this, anyone want to say anything? So with this, we will get to know what all, like after 85 hours, even in Shubh Yoga Foundation only, you can join as a trainer. That is an extra point in 85 hours course. So this is the brief class scheduled, like my week wise. You will be having 35, like in further I'll explain, you will be having a live sessions also like this, and even you will get a PDFs, PPTs, whatever documentary things you want to know. Because in within this hour, we will not get, like I'll explain and I'll go, but you can't remember everything after listening, right? So after this session also, if you want to study, if you want to know more about this, even you will get a PDFs, and you will get the PPTs, whatever documentary thing you need, you will get it. But this is a brief class schedules from Monday to Saturday, and Sunday is revision part. Now, coming to main topic, why we need to know Garbhsanskar. So, what is Garbhsanskara? So here I concluded some 5 points why you have to know Garbhsanskara. Benefits of Garbhsanskara. Obviously, as briefly I explained, it creates a bond between fetus and mother. Because now many of us we are seeing in pregnancy we have complications, and in babies, like immediately after birth, babies have many complications. Even some babies can't survive. That conditions we have, right? This Garbhasanskara, obviously it was followed years ago. Like basic thing, basic knowledge of Garbhasanskara we can say is, now in pregnancy we will speak to our kid, right? Our fetus. In womb with fetus we will speak. And some moments may be experienced while speaking. If you say something happiness to a fetus, baby will kick. After 6 months, when baby starts to kick, baby will kick. That is one part of the Garbhasanskara only. We are connecting a fetus in womb only. In womb only we are speaking with the baby and we are connecting, right? In same way, by following the music techniques, by following some asanas or mudras, or by following some chanting shlokas, or by speaking with the fetus, these all step by step, month-wise, what all changes. Because, as I said, example kicking, we if we speak with the fetus in first month or second month, obviously, in first month or second month, obviously baby will not kick, right? Because still kicking process is not present only in first month or second month. So month-wise, what all changes will happen in a baby, we will see in anatomical and physiological changes, right? So by knowing that, month-wise, what all activities you should do to get connected with the fetus, this overall Garbhasanskara will teach you one thing. And another thing, obviously we all know, in especially in pregnancy and post-pregnancy, due to hormonal imbalance, due to environmental changes, mothers will go through many depressions, postnatal depression. Some mother went into postnatal depression. We will listen surrounding us, right? Because it will be due to our hormonal changes, one thing. With that, environmental surrounding, like surrounding support also we need. If we won't have environmental supporting, it may be husband, it may be in-laws, or it may be in home, or it may be workplace, how we can maintain our mind in a cool way, relaxed way, this Garbhasanskara will teach us. And another thing, improves our health. Obviously, in this, what ahara you have to take, what activities you should not do, what activities you should do, it will teach us. And invites positivity. Obviously, by doing all these positive vibes, we will be in a positive, right? So, no any depressions, we will be healthy, and the surroundings also will make our surrounding to combine with us. So, it will teach us the positive vibes, improves personality. Obviously, like by doing all this, during pregnancy, the baby's mind is connected with us, we are happy mood and we are healthy. So, this will give a positive personality. But the main thing here is the Garbhasanskara music. Some musics are there. Even I'll show you which type of music you should listen, and I'll play, or else I'll forward in a group also. The particular musics are there, which we will follow in Garbhasanskaras. These all, as we discussed till now, this will connect with the baby, our mind will be calm, it will relax our mind. These all we will do. This is overall knowledge about the Garbhasanskara. So what is prenatal care? Why we should do? Obviously, prenatal or perinatal is, the stage starts from your planning. Begins from the planning of your pregnancy till the 9 months of gestation, till delivery. It will be come under prenatal stage. It may be prenatal or perinatal. Prenatal means from planning of a pregnancy till conceived, till the fetus involves our womb. From when we conceive till then, the 9 months of gestation till delivery, it will come under prenatal conditions. So why we have to do what we why we have to learn about this is, as I said, nowadays we have many complications in our pregnancies, pre-pregnancies. From the day of marriage, from the day of planning of a pregnancy, the mothers are suffering. some may be not able to conceive, or some are getting miscarriages. Even after pregnancy, some are getting complications in pregnancy. You may be here. 10 in 5 members will be 10 in 5 members will be having a bed rest nowadays in pregnancy. You may be heard in your relatives. If they are pregnant from 2nd month, they will get spotting, and doctors will advise them bed rest, right? So why it's happening? Due to not caring in this prenatal or perinatal stage. One thing, due to technological development or due to adulteration, whatever we are having, it may be, if I say I'll not have any junk food, I am fully dependent on healthy vegetables and fruits only, then too my health will be upset because of adulteration. Because of adulteration, whatever we are having, vegetables, fruits, those are adulterated one only. We are not getting any pure ones like from farm, right? Without any seasons also, we are getting every fruits now, because they will put some chemicals and they will ripen it. Because of that artificial ripening, we are not getting any healthy diet. Though I am having a vegetable fruits only, I am not fully accurate 100% healthy because of adulteration. So in this, obviously now we everyone can't go in farms and we can cultivate our own vegetables and fruits, right? We are not that much, we won't have time. With this adulteration food and vegetables only, though we are having, with that only how we can maintain our health in a food way or in a activities way, and how we can, if already I have a complaints, how we can treat it, what all I can follow. That all will come under prenatal care. Obviously, in pregnancy, that's what I explained. Like it may be maternity, neonatal, everything. Whatever care we should take in a prenatal or perinatal, all we will study in a topic. What is this postnatal? Postnatal means from the day of delivery till 1 month. The baby is known as neonate. So in this 1 month, what all things we have to follow? Immediately after birth, how we should care baby, when we should give them a breast milk. If my breast milk is not there, what I can give, and when, in which hours I should feed baby. With that baby's care, how I should maintain my own health. Like obviously, during pregnancy, all will care women. But immediately after delivery, the women will be neglected, and they all concentration will be only on newborn, right? Only everyone will be concentrating on newborn's sleep, newborn's food, but no one will care women. But even in this first 1 month, especially 1 month, though we have to care till 3 to 6 months, especially 1 month, how they take care of a baby, even a woman needs same care, because her all physiological, anatomical, every body will be having changes, especially hormonal imbalances will be very much after delivery. So how you can care? Because of this reason only, because of negligence only, after delivery, after 6 months, 3 months, the woman will start complaining, like I have severe back pain, or I'm like other things. Many complaints are there, especially women's. They will get start with the complaining, right? Because of this reason. First 1 month, particular foods are there which the women have to take, and particular activities are there which women have to follow, so that even she will not go into postnatal depression, and even she will be healthy further also. So these all we will come to know in a postnatal care, with not only women, with baby care. Obviously, we will see newborn care also, what all we have to care, what all we have to do in postnatal first 1 month. With that, women's care also we will see. So, as I explained in initial stage, it is a course of live recording class sessions will be daily, with PDF books in English and Hindi, both are available, and even soft copies of PPTs also, if you want, whichever PPTs I'll show you on daily basis. If you want PPTs, even I'll share the PPTs. And at the end of the course, you will get a hard and soft copy of the certificate. As initially I explained, difference between 50 hours of our course and also 85 hours of course. And this was a brief discussion, brief knowledge about the course, what all you will get to know and what all benefits you will get to know after completing the course, and the details of course with the amount, fees, everything. You can message to given number, or you can message to admin, group admin. They will clarify your doubts. So if you have any doubts, you can ask.
And what is the timings of this course, like schedule?
Actually, according to our like association, they mentioned as 8 p.m. to 9 p.m.